The man in room 14 hadn't spoken a word in 3 days. Not to the attending physician. Not to the social worker who came by twice with a clipboard and a practiced smile. Not to the night shift aide who left his dinner tray at the door because he wouldn't let anyone pass the threshold. The staff at Glenhollow Psychiatric Facility had a name for patients like him. They called them the Walls. And by the time Nurses Week rolled around in mid-May, most of the day team had quietly decided that Marcus Teller was a wall that wasn't worth climbing. His chart said 51 years old, 22 years in the Marine Corps, 3 deployments, Fallujah, Helmand, a third one that was listed only as Classified Theater 2009. Medically retired after an IED incident that took 2 fingers off his left hand, and according to the psych notes, a portion of something harder to name. He'd been brought in on a 5150 hold after his neighbor called it in. The neighbor told the responding officer that Teller had been sitting on his front porch for 36 hours straight, not eating, not sleeping, just watching the street. The neighbor said it like it was strange. Like a man guarding his perimeter was something to be alarmed about. What the chart didn't say, what no chart ever said, was that Marcus Teller had a dog. Her name was Compass. 62 pounds of Belgian Malinois with a scar along her left hip and a temperament that could shift from stone still to motion in under a second. She wasn't a therapy dog in the soft, vaguely performative sense that hospitals like to advertise in their lobbies. She was a working animal. She'd been trained through a veteran placement program in Tucson, paired with Teller after his retirement, and in the 4 years since, she had done what nothing and no one else had managed to do. She had kept him tethered. Not happy. Not healed, but tethered. When the paramedics had come for Teller, Compass had come too. That part wasn't optional as far as Teller was concerned. The paramedics, to their credit, hadn't argued. But Glenhollow was a different matter. By the time Nurse Daphne Oury arrived for her first shift on that unit, Compass had already been the subject of 2 incident reports, 1 administrative email chain, and a near-physical confrontation between Teller and an orderly named Beckwith, who had made the mistake of reaching for the dog's collar without asking. The facility's official position, delivered via a laminated policy sheet taped to the outside of room 14's door, was that animals were not permitted in patient rooms except under specific therapeutic program guidelines, and that Compass's paperwork, her certification, her ADA documentation had not yet been processed and verified. It had been 4 days. The paperwork sat in a folder at the nurse's station. No one had processed it. Daphne was 31 years old, and she had transferred to Glenhollow 6 weeks earlier from a VA outpatient clinic in Flagstaff, Arizona, where she'd spent 4 years doing psychiatric nursing for veterans before the funding got cut and the program got folded into a general mental health initiative that everyone on staff knew was just a gentler way of saying the veterans unit was being disbanded. She had not wanted to leave Flagstaff. She had not wanted to leave VA work. But she had student loans and a mother in Phoenix who was 73 and had started calling twice a day about her knee, and Glenhollow had offered her a salary that made the choice feel less like a choice and more like a conclusion. She had not told anyone at Glenhollow about her VA background, not out of strategy, not out of secrecy, it just hadn't come up. In the 6 weeks she'd been there, orientation had covered charting software, the facility's trauma-informed care policy document, 32 pages, last updated in 2019, and the parking structure situation. No one had asked her what she knew about PTSD. No one had asked her much of anything, really. She heard about room 14 from the outgoing nurse during handoff on a Tuesday morning. "He's what we call a static situation," said the nurse, a man named Gould who had the practice detachment of someone who had been doing this job too long in a facility that rewarded detachment. "Won't engage, won't consent to most assessments. The dog is a whole thing. Dr. Whitmore has been trying to get psych pharmacy involved, but Teller won't take anything, so." Gould shrugged in a way that communicated something Daphne couldn't quite name. Not cruelty. Something more like exhaustion that had curdled into indifference. "Leave the tray at the door. Don't reach for the dog. Don't take it personally when he doesn't answer." Daphne looked at the chart on the tablet. She looked at the laminated policy sheet on the door. She looked at the name written in black marker on the whiteboard outside room 14. "Teller, M." She knocked. No answer. She knocked again and said, through the door, Mr. Teller, I'm Oury. I'm your nurse today. I'm going to leave your breakfast here. I'm not going to come in unless you say it's okay. Silence. She left the tray. She walked back to the nurse's station and pulled Compass's documentation folder from the pile where it had been sitting for 4 days. She read through it. The certification was current. The ADA registration was current. The letter from Teller's VA primary care provider was clear, specific, and professionally formatted. There was absolutely no reason this paperwork had not been processed. None. It had simply been set aside, and then set aside again, and then a long weekend had happened, and now it was Tuesday, and a man in room 14 hadn't eaten a real meal in 4 days because he wouldn't let anyone into the room, and the dog who could have told them how he was doing was being kept out by a policy sheet that applied to a situation that was not this situation. Daphne brought the folder to the charge nurse, a woman named Bertram, who had an office with a half-dead succulent on the windowsill and a manner that suggested she had heard every possible complaint and found all of them slightly tedious. "This is complete," Daphne said. She set the folder on the desk. Compass is a certified psychiatric service animal under a valid ADA registration. The VA documentation is current. There's no procedural basis for keeping her out of the room. Bertram looked at the folder. She did not open it. "Dr. Whitmore prefers to have the medical team review animal accommodations before." "The law doesn't require Dr. Whitmore's review," Daphne said. She kept her voice level. She'd had this conversation before, in different rooms, with different people who had different job titles, but the same basic expression. ADA Title II applies here. The service animal goes where the patient goes. That's the federal standard, Darby. We have a process. The process has been running for 4 days while the patient hasn't eaten. Bertram's mouth tightened slightly. "I'll flag it for Dr. Whitmore's afternoon rounds." Daphne looked at her for a moment. Then she said, "I'll document that the recommendation was made and the timeline." She walked back to the nurse's station and she documented exactly that. At 11:30 that morning, she went back to room 14. She knocked. She said, through the door, same as before, "Mr. Teller, it's Oury. I'm not coming in. I just wanted to let you know I looked at Compass's file this morning. Her documentation is complete and valid. I've submitted a formal request to have her cleared for room access, and I've documented the request and the timeline. Someone will follow up this afternoon." Silence again. Then, very quiet from the other side of the door, "Why?" It wasn't a question, exactly. It was the kind of word that comes out when someone is too tired to inflect it properly. Daphne said, "Because it should have been done 4 days ago, and it wasn't." Another silence, longer this time. "You military?" His voice was rough in the way of someone who hadn't been using it much. "No," she said, "but I did 4 years at the Flagstaff VA." A pause. Then, psych, psych. She heard something shift on the other side of the door, not the door opening. Just a small sound, like someone adjusting their position, like someone who had been braced against something and had, for a moment, let the brace loosen slightly. "Okay," he said. It didn't mean anything specific, but it wasn't nothing. She came back at 2 o'clock with a tray. Not the standard institutional lunch, but a sandwich she'd asked dietary to put together. Nothing complicated. Turkey on wheat with the mustard on the side, because she'd noticed from the previous discarded trays that he'd scraped the condiments off. And she knocked and said his name, and said she was leaving lunch, and that Bertram had told her doctor. Whitmore had approved Compass's room access pending a brief review that afternoon. The door opened. Not all the way, maybe 8 inches. Teller stood in the gap, and he was taller than she'd expected, broad-shouldered in a way that the chair-hunched posture of his intake photos hadn't suggested. And his eyes, she noted this the way she always noted it in her VA patients, as clinical data. As important information, his eyes were doing that thing she'd seen before, where the person is present and also simultaneously monitoring 17 other things, where the alertness is so constant it has become its own kind of exhaustion. Behind him, she could see Compass. The dog was sitting, upright, watching Daphne with the focused attention of an animal that has been trained to read a room. "I'm Oury," Daphne said again, in person this time. Teller looked at her. He didn't say his name because she already knew his name, and they both understood that. He looked at the tray. He looked at the sandwich. He looked for just a moment at the mustard on the side. "Dietary does that if you ask," she said. "Puts the condiments separate." He took the tray. He didn't say thank you, but he stepped back and didn't close the door all the way, and she could see that Compass had come to sit closer, close enough that her head was near his knee, and Teller's left hand, the one with the missing fingers, had dropped without his seeming to notice and was resting on the top of the dog's head. Daphne went back to the nurse's station and wrote her notes. She wrote them carefully and specifically the way she'd been taught to write VA notes, where precision mattered and vagueness could mean a veteran fell through a crack that no one closed because no one could find the edges of it. Dr. Whitmore came by at 4. He was a compact, efficient man in his mid-50s who ran on the particular energy of someone who had a great deal to do and had organized himself around doing it quickly. He read the file Daphne had updated. He read the ADA documentation. He said, "Looks like this should have been processed on day 1, which was a sentence that managed to acknowledge the failure without attaching it to anyone specific, a skill Daphne had observed in administrators across multiple institutions. "Yes," she said. "Compass is cleared for room access effective immediately." He signed the form. "Good catch, Oury." It wasn't a catch, she said, and she said it quietly, almost to herself, because what it was a baseline, a thing that should never have needed catching, a thing that a man had been waiting on for 4 days in a room alone. But Whitmore had already moved on to the next chart, so she let it go. She went back to room 14 with the signed form. She knocked. The door opened, wider this time, maybe 14 inches, and she told him Compass was officially cleared for room access and that she was putting the signed authorization in his chart and on the door so that every staff member on every shift would know. Teller looked at the form. He looked at it for a long time. "You're going to want to eat the dinner tonight," she said. "Dietary is baked chicken on Tuesdays. It's not bad." His jaw moved, very slightly, not quite a smile, but something adjacent. "Okay," he said. She learned more in the next 48 hours than she had learned about him in any amount of reading his file. Not because he became suddenly open, he didn't, but because small things accumulated. He would answer questions that were specific and practical. He wouldn't answer questions that felt like assessments, and he could feel the difference immediately, even when the assessment was disguised as small talk, which she had stopped doing by the second day because it seemed disrespectful to try. He ate when the food was recognizable and not oversauced. He slept in short segments, facing the door, and Compass slept at the foot of the bed or just beside it, and the nights when the dog was close to him were the nights the night aide noted no disturbance calls from room 14. On Thursday morning, she arrived to find that Beckwith, the orderly who had grabbed for Compass's collar on day 1, had filed a complaint with Bertram stating that Teller had been verbally threatening in a prior interaction and that he had safety concerns about the dog. The complaint was 2 pages long and described Teller in language that made Daphne think of the kind of words that get used about veterans when the person using them doesn't know anything about veterans and has mistaken vigilance for aggression and guardedness for threat. She read the complaint twice. Then she went to Bertram's office. "I want to formally respond to this," she said. Bertram looked up from her screen. "It's a staff concern, Oury. We take those seriously." "I do too," Daphne said. "I also want to note for the record that the incident Beckwith is referencing involved him reaching for a service animal without warning or consent, which would cause most service animals to respond protectively, which is what Compass did. Mr. Teller's verbal response was to that action. And I want to note that the characterization of Mr. Teller's general behavior in this complaint uses language that is not consistent with his clinical presentation as I have observed it. You've known the patient for 3 days. I've been his primary nurse for 3 days. I have 4 years of VA psychiatric nursing before that. I'm not characterizing him from nothing." Bertram's face did the thing it did, the tightening that wasn't quite defensiveness and wasn't quite consideration but was somewhere between them. "I'll note your response. I'd like to note it formally. In writing. In the record. A beat. Fine." Daphne wrote the response. She wrote it carefully, citing the ADA provisions around service animal behavior, citing the specific sequence of events as documented in the prior incident report, citing her own clinical observations. She wrote it the way she'd written things at the VA when she knew the writing would matter later. When she knew a document would be read by someone trying to understand what had happened in a room where the stakes were higher than they looked. On Friday, Teller's VA-assigned social worker came by, a man named Dayton, from the regional VA office, who had the harried look of someone managing too many cases across too large a geography. He met with Teller for 40 minutes. Afterward, he stopped by the nurse's station and told Daphne that Teller had apparently spoken more in that 40 minutes than he had in the 3 prior VA check-ins combined. What changed? Dayton asked. Compass got cleared for room access, she said, and someone stopped trying to assess him and just treated him like a person. Dayton looked at her. You from VA background? Flagstaff. 4 years. It shows, he said. And then, because they were both busy and there was more to do, they moved on. What happened the following week was quieter and slower than it sounds when described in sequence. Teller didn't have a breakthrough. He didn't have a moment of catharsis where something cracked open and everything changed. He had small, incremental forward motions. He let the dietary aid leave the tray inside the door instead of outside it, and then eventually leave it on the table near the window. He spoke to Dayton a second time without Daphne having to facilitate the meeting. He agreed to a conversation. Not a session, he was specific about that, not a session with the psychiatrist on Tuesday and Thursday mornings, and the conversations were not long, but they were real. He also, on a Saturday afternoon when the unit was quiet and Daphne was doing her rounds, said her last name from the other side of his door in a tone that wasn't a question but functioned like one, and when she came to the door, he said, "What made you check the paperwork?" She thought about it for a second. The real answer, the honest answer was, because 4 years at a VA teaches you that the paperwork is where veterans fall through. The gap is almost always in the paperwork. The gap is almost never a person who actively decided to harm someone. It's a folder that got set on a pile, a policy that got applied to a situation it wasn't designed for, a system that processes forms faster than it processes humans. Because it mattered, she said, and no one else had. He was quiet for a moment. Compass sat at the door the whole time, he said. The 4 days, she'd go back and forth, the door to me, the door to me. She knew, dogs usually do, Daphne said. Yeah. He looked down at Compass, who was leaning against his leg with the easy, total weight of an animal that trusts completely. She's the only reason I'm still here. He said it factually, without drama, in the way veterans sometimes state the most important things. Not this place. I mean, still anywhere. Daphne looked at him. She said, I know. She said it the way she'd learned to say it at the VA, not as a throwaway, not as reassurance, but as acknowledgement. I know what you're telling me. I hear it. I'm not going to minimize it or deflect from it. He nodded, very small. The same nod she'd seen veterans give when something is understood that they didn't think would be understood. The 3rd week brought what Daphne would later, when writing her formal incident documentation, call the escalation. Beckwith had, it turned out, not let the matter drop. He had spoken to 2 other orderlies and to someone in administration, not Bertram, but above Bertram, a man named Holt who managed the facility's residential services and who had, by all accounts, a particular investment in the idea that Glenhollow ran clean and without conflict, and that complaints were things to be resolved quickly, which in practice often meant resolved quietly, in the direction of whatever required least paperwork. Holt called Daphne to his office on a Wednesday morning and told her in measured tones that there were concerns about her approach to the Teller case, that she had been, in his words, adversarial with other staff, that the formal response she'd submitted regarding Beckwith's complaint had created tension on the unit. Daphne sat across from him in a chair with good lumbar support and looked at the window behind him, which had a view of the parking structure. The response I submitted was accurate, she said. Accuracy isn't always the only consideration in a team environment. When there's a formal complaint about a patient in a file that he may eventually have access to, she said, accuracy is the primary consideration. Holt was quiet for a moment. He had the look of a man who was used to that being the end of the conversation. We value all our staff's well-being, including Mr. Beckwith's. I value it too, she said, which is why I documented exactly what happened rather than what Beckwith's account describes as having happened. Because if this comes back later, if Teller's care is affected, if a review occurs, if anyone ever asks what happened in this unit in May, the record needs to be accurate. Another silence. You're very certain of yourself, Holt said. It wasn't exactly a compliment. I'm certain of what I observed, she said. and what I documented, and what the law says. She stood. Is there anything else? There wasn't. She walked back to the unit and she sat down at the nurse's station, and she was, for a moment, just tired, not defeated, but tired in the specific way of someone who has spent energy on something that should have required no energy, who has had to fight a thing that should not have been a fight. She went to room 14. She didn't knock for a long time. She just stood near the door for a moment in the quiet of the hallway. Then she knocked, and Teller said, "Come in." The first time he had said that, not just opened the door, and she came in, and Compass looked up at her from the floor where she was lying, and Teller was sitting in the chair by the window with a paperback open face down on his knee, which was also new. "How are you doing?" she asked. Not clinically, just person to person. He thought about it, which was something she'd noticed. He always actually thought about questions before answering them, which most people didn't do. "Better than 3 weeks ago," he said. "Worse than I'd like." "That sounds about right," she said. "You look like you had a meeting." "How can you tell?" "Posture," he said, without elaborating, which she respected. "I had a meeting," she confirmed. He was quiet. "Then about me?" "About documentation," she said, "which is a thing I'm very comfortable with." Something moved in his expression. Not a smile, but close to the neighborhood of one. "They give you a hard time?" he asked. "They tried," she said. He looked at her for a moment. Then he looked out the window. "People think because you're not in the fight that it's different," he said. "But you are. The fight just looks different in here." She thought about that. It was true in a way she hadn't articulated to herself, about what it felt like to document carefully and fight quietly and choose the word that would stand up to scrutiny later, in the small wars that happen in fluorescent-lit hallways with clipboards instead of anything else. "Yeah," she said, "it does." She sat down and they talked, not a session, not an assessment, just talked, for the better part of half an hour, about small things and some larger things, and Compass moved from the floor to put her chin on Teller's knee. And the afternoon light came through the window and made the room feel different than it had 3 weeks ago when it had been sealed and silent. What happened after is a matter of record, because Daphne made it one. The formal review of Beckwith's incident report concluded that his account of the initial dog interaction was inconsistent with security footage and with 2 other staff members' accounts. Holt's conversation with Daphne was itself reviewed by the facility's HR coordinator, who flagged it as potentially coercive given the documented sequence of events. Glenhollow updated its service animal policy, in writing, to include specific language about AD-certified psychiatric service animals and the timeline for processing accommodation documentation, 72 hours maximum from admission. Teller stayed for another 2 weeks beyond the original hold period, voluntarily, which his social worker Dayton called the first voluntary extension in 4 years of my caseload. He left on a Tuesday morning with Compass beside him and Dayton at his side, and a follow-up schedule that was, for once, actually documented in a way that would hold. He stopped at the nurse's station on his way out. Daphne was doing her morning charting. He put a folded piece of paper on the desk in front of her. She looked up. "You don't have to read it now," he said. His voice was the same rough, underused voice it had been at the door on day 4, but something in the production of it had changed. Less like something held under pressure, more like something that had found, not ease exactly, but room. She didn't read it until lunch. It was a short letter, written on the blank back of a Glenhollow patient information sheet, in handwriting that was very precise and very deliberate, the kind of handwriting that suggests a person who learned it seriously. It said the paperwork mattered. "And you made it matter when nobody else did. I'll remember that. Compass says thank you too." Teller Daphne held it for a moment. Then she folded it back along its crease and put it in her jacket pocket. The nurse's station was busy and noisy, and the coffee machine in the break room had been broken for 9 days. And there was a new admission coming up from the ER, and her charge nurse wanted to talk to her at 2 o'clock about something that was probably more documentation. She went back to work, but she carried the letter all day, and she would carry it for a long time after that, not as a souvenir, but as a reminder of what it meant to fight a small fight well in a quiet hallway where nobody was watching, for someone who had survived every large thing and nearly been undone by the small ones.